All right, good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. And tonight I'm talking about mast cell activation syndrome and pain. I've done a number of videos on mast cell activation syndrome. You can go back and watch them. And I think they may help you to kind of get the context of what I'm talking about tonight. And if you have any questions, send them to info@gatesbrainhealth.com. I am trying to type up these videos. I may be a little behind, but I am trying to type them up into a newsletter format. So if you're interested, go ahead and send that to me. Go ahead and send us a request for more content. With all that being said, why mast cell activation syndrome? Why now? Mast cell activation syndrome was actually coined, I learned last night, back in the 80s. I thought it was something that was more discussed around the year 2000, but it was coined in the 1980s and really popularized between 2010 and 2020. I cite Dr. Afrin in every one of these broadcasts because Dr. Lawrence Afrin wrote the book Never Bet Against Occam. And the premise of his book, he's a hematologist dealing with many chronically ill people, is that if you have one explanation that can explain a multitude of phenomena and a multitude of clinical presentations, then Occam's razor is such that we should say that is the cause of these problems, not multiple disparate causes. So if you have one cause to explain it, then you should go with that. And mast cell activation syndrome has gained a lot of attention in the last decade because we now know that 1 in 5 people have it, and it seems to be able to relate to many chronic conditions. For much of my career, I've dedicated a lot of time and energy to almost validating or bringing validation or bringing understanding to those who are chronically ill who look quote unquote normal but do not feel normal. They may have chronic fatigue, they may have chronic pain, but these were individuals who had like fibromyalgia, and I did a lot of videos through the years on fibro, a lot of content on fibro and chronic fatigue and things of that nature. Well, it seems that mast cell activation syndrome may have been the elephant in the room that we weren't really seeing. And it seems that this mast cell activation syndrome, which has different types of treatments targeted at it, can, when you apply these treatments, maybe provide someone with irritable bowel syndrome or fibromyalgia or migraines a much greater benefit through this application. That's kind of the idea. So another piece of this to kind of understand is that mast cell activation syndrome is thought to be largely, not entirely, but largely genetic. And so there are aberrations in these things called KIT mutations, KIT, which may predispose someone for their mast cells to be hyperreactive. What are mast cells? Mast cells are most commonly associated with allergies, allergic disorders, anaphylaxis, asthma, where when they sense an allergen, there's a crosstalk between IgE, hypersensitivity responses, and then the mast cells release tons of histamine, and the histamines then cause the allergic type of phenomena, which is why so many people take antihistamines who have allergies or asthma. What we're seeing is that 1 in 5 people may be predisposed for these mast cells to release excessive histamine, and it doesn't always manifest in an allergic response. Some people have an allergic history, like they may have a history of itching, or they may have a history of asthma, or they may have a history of hay fever. But then they're also, through time, on their timeline, developing something like horrible bone pain or chronic fatigue, or they have unexplained rashes, or they have all of these things that come and go and are really difficult to explain and difficult to pin down. So that's the preamble on mast cell activation syndrome. And now we're going to talk about mast cell activation syndrome as it pertains to pain, notably chronic pain. Let me go over here. I'm going to hide that one. I'm going to show this one. I got this off of a website, Anesthesia Key, basically. It's for anesthesiologists, where they're discussing basically pain responses. I think it's important for everyone out there to understand that your pain is not necessarily proportional to tissue injury. Very, very important. This is why so many doctors don't take patients who look normal maybe seriously all the time, because you look normal. You don't look like someone with a broken arm, or you may not look like somebody with a brain tumor or have the MRI findings thereof. And doctors have a hard time understanding why someone would be in so much pain. Unfortunately, there's not great understanding of central pain disorders throughout healthcare. So a lot of this is missed. And in essence, pain is not pain until it gets to your brain. Before a signal, for example, let's say I were to take a pen and poke it into my hand or poke it into my shoulder, and it's something sharp and it's going to cause maybe some tissue injury. Well, what happens here is they're illustrating in the diagram with a thumbtack poking the finger, is that there's going to be a signal which is referred to as nociception, and this nociceptive signal is going to basically go into the back half of the spinal cord. It goes into the back half of the spinal cord. It's relayed across into something called the spinothalamic tract. And this tract carries pain signals up to the area of the brain called the thalamus, and then to higher regions of the brain in the parietal cortex, primarily where we're going to have the perception of pain. What is important to realize is that actually 75% of these nociceptive fibers that then become relays into this spinothalamic tract, is that about 75% of them never actually get to higher levels of the brain. There's a lot of filtration of this pain. They may end up in the brainstem and the spinal-reticular tracts. So because of that, we need to understand that pain is not always proportional to the tissue injury. Really, really important point. So if you have chronic pain, we may have to say, well, maybe there's something else going on. Has your brain learned painful circuits, or is there something going on in your mast cells? So with this, we see that mast cell activation syndrome may lead to pain disorders. In this box over here on the right, these researchers talk about different studies where they've shown that migraine patients, for example, if they sample their blood during a migraine headache, they'll see increased levels of histamine in their blood compared to normal controls, or when they're not having a migraine. Same thing with pelvic and bladder pain, atopic dermatitis, inflammatory bowel pain, fibromyalgia. As I've mentioned, these are individuals with chronic widespread pain, lots of fatigue, brain fog, vulvodynia, complex regional pain syndrome, which oftentimes involves pain in an extremity, such as an arm or a leg that's been traumatized, and the pain never heals, in essence, and the pain continues. I'll probably do a whole broadcast on that. So it's very interesting that mast cell activation syndrome seems to be tied to these chronic pain conditions. And it's very, very, very interesting. And it seems that these mast cells, which are represented here, release all sorts of chemicals that stimulate pain neurons. So we know that, for example, if I poke myself in the shoulder with this pen, that there are going to be chemicals released, such as substance P and bradykinin, and actually histamine will be released. Well, mast cells will join in on that, and they release basically the same chemicals, including serotonin and inflammatory cytokines like interleukin-6. So let's show this one. So to kind of summarize, mast cells release mediators that interact with nociceptors. Again, nociceptors are the pain fibers, but before it becomes pain in your brain. Mast cells are located near the nociceptors. So mast cells tend to be in epithelial tissues. They're throughout the body, but they're very much so in our skin. Our digestive tract is basically skin. Our lungs have basically skin tissue in them. So mast cells are in all these regions, and particularly in the epithelium. And the mast cells when they release their inflammatory mediators, we have to know that a lot of the pain neurons are in our skin tissue. So there can be this almost direct connection between mast cells in the skin, the epithelial tissue, to our pain nerve fibers. And this activation results in nerve fibers releasing neuropeptides that activate neuroinflammation. So the nerves, once they're activated, can actually create more inflammation that keeps them activated. So it leads to this vicious cycle as to why someone can eat something, all of a sudden their entire body hurts, or their joints hurt, or they're exposed to some sort of allergen and they feel like they have fibromyalgia. This is the explanation. So I hope this makes sense. I'll probably do videos related to single topics within this discussion, such as migraines or complex regional pain syndrome. But I welcome your feedback, welcome your comments, and thank you for watching. And I will be back later this week or next week with another talk.